Okay, so as I said, we're going to briefly touch on intubations and we're going to briefly touch on cricothyrotomies in the same video. I'm not going to go over demonstration. If you need further demonstration, we can do that in a classroom. But I'm not going to demonstrate that on video because it is an advanced level skill, and I do not want people practicing this if you are not the correct level of provider. So we have finished with our BVM, with our OPAs and MPAs, and our King tubes. An ALS provider arrives on scene and decides that it is time to intubate the patient. King tube will be taken out and the patient will be intubated. If the intubation is not able to be obtained, then last but not least, your patient may need a cricothyrotomy, which is a very invasive surgical procedure, cutting open the neck and inserting a tube. This should be your last ditch effort. Cricothyrotomy should never happen before intubations unless the emergency deems that an intubation is not accessible. But an intubation should be considered and possibly even attempted before cricothyrotomy is performed. So to wrap up, let's remember our levels of airway out there. When you arrive on a patient that is not breathing, we're going to bag the patient with a BVM. We're going to get enough oxygen into their system so that they can circulate. After 5 minutes of BVM, patient has not improved, we are going to put in an airway adjunct, either an OPA or an MPA, depending on if they have a gag reflex or not. After that, if they do not have a gag reflex, we're going to King tube. If an ALS provider is on scene or arrives on scene, they may consider and perform an endotracheal intubation. If none of those are able to be performed, a cricothyrotomy may be discussed as a last ditch effort. Remember, we don't want to be walking into emergency scenes and immediately decide to cric patients. We want to try to do the least invasive first and work to the most invasive. Use your knowledge out there, use your protocols, and use your best judgment when performing any airway skills. If you have any further questions, you know where to find me. I have no problem going over these skills in person, and I have no problem allowing you time to practice these skills in person so that you can become better familiar with it in a hands-on environment.